है, retinal disorders. So what about this question, secondary cataract? What is secondary cataract? Before we start on to a new topic, I want let us quickly revise this with questions. So first of all, secondary cataract is same as the after cataract, isn't it? It is same as the after cataract, which is same as PCO, and the best treatment is Nd:YAG capsulotomy. Okay? No UV rays are not at all associated. Surgery should not be done, and it's not secondary to eye problem. Okay? It's not secondary to eye problem. Very good. Good. All of you are correct. So laser assisted cataract surgery is done with laser of how much frequency? How much frequency? 10 to the power minus 15. That is the meaning of the word femto. Isn't it? ठीक है बच्चे, ये सबको आता है ना, सिंपल है. चलो अब ये देखो, this is one expected question this year. Expected question. Which instrument is this? What do you think? It is a tongue shaped one. है ना? Tongue shaped. It's not having a very sharp edge. So this is for making tunnel. It in which surgery? What is the name of the surgery here? You can do this in SICS, small incision cataract surgery. ठीक है बच्चा? Very good. Good. ऐसे भी पूछ सकते हैं that this instrument is used for which surgery? Cataract, glaucoma, squint. So you can say cataract surgery. Okay, which surgery? Small incision cataract surgery. Very good, very good. चलो अभी ये बताना. Just a second, friends. हाँ जी. A very important one. So Elshning pearl is seen in what? Elshning pearl is a type of what? जो एक जना बोल देते हैं वही सब बोल देते हैं ना. Absolutely wrong. What was complicated cataract? Elshning pearl, pearl and ring, pearl and ring. Secondary cataract, after cataract, है ना? What one has marked, everybody would say the same. Complicated cataract was polychromatic lustre. Guys, don't get confused between a secondary and a complicated cataract. Complicated cataract is secondary to ocular cause. Okay, it happens with everyone. They get confused between the word secondary cataract and a complicated cataract. Is it now clear? Those who have said A earlier, is it clear? Sorry, C earlier, is it clear now? Okay, Dr. Madhavi, Dr. Sylvia, no, D to nahi hai. Okay, we don't have D here. Chalo, good. So ये बताइए, modern intraocular lens is not made up of. So I'll tell you the answer, guys. The answer is glass here. Now please see, modern intraocular lens can be made up of three materials. First of all, these lenses are rigid lenses. That means non-foldable lenses. Another type of lenses is the foldable lens. Now rigid lens is made up of PMMA. What is PMMA? Polymethyl methacrylate. Okay, this is a rigid lens. Rigid lens means that which is not foldable, and foldable lenses can be of again two materials, acrylic and silicone. Okay, acrylic and silicone, and the most commonly used lens is acrylic lens. What lens we most commonly use is the acrylic lens. Is it okay, friends? Acrylic lens is the most commonly used lens, acrylic and silicone. ठीक है बच्चे? So glass is the best option here. Glass का तो नहीं बनता lens. ठीक है? चलो, so let us now start with the next topic, important one, a short one but a very important one. ठीक है? We'll talk about conjunctiva for the next coming hour. Conjunctiva. चलो, first understand something about conjunctiva. The word conjunctiva is being derived from a term conjoin. What is conjunctiva? It means conjoin. So basically it joins something. It joins what? It joins the eyelid with your eyeball, isn't it? This joins your eyelid with your eyeball. Now all of you have a look here. All of you have a look here, guys. So I told you this is the sclera, and over sclera you have a transparent layer, and that is conjunctiva. I have told you that, okay? But that conjunctiva is only one part of conjunctiva. It's only some portion of conjunctiva. This is your bulbar portion of the conjunctiva. Have a look here. This is your bulbar portion of conjunctiva. Now this part of conjunctiva, it is attaching the globe with the eyelid. So this part of conjunctiva which is behind the eyelid is called as the palpebral part of conjunctiva. Is it clear? So you have mainly three portions of conjunctiva. The one which is over the eyeball, you call it bulbar portion. The one which is behind the eyelid is called as your palpebral portion. And the third one, which is the line here, the junction here, this one, this is called as the fornix. Okay. So let's write something down. We have conjunctiva. The meaning of conjunctiva is to join. Basically, conjunctiva joins what? It joins eyelid with the globe. Eyelid with the globe or with the eyeball. ठीक है ना? So we have three parts of conjunctiva, friends. We have three parts of conjunctiva. The first portion is the bulbar portion. Please understand the word bulb. Bulb means the eyeball. ठीक है? Bulbar portion, which is over the sclera. The second portion is the palpebral portion, which is actually behind the eyelid. This is behind the eyelid. ये वाला portion है ना, आपको pink pink दिखता है ना, इस pink के ऊपर एक transparent layer है, and that layer is your palpebral portion. Okay. Now what about the third part? Third part is your fornix, which is in between these two, in between 1 and 2. ठीक है? These are the three parts of conjunctiva. यहाँ तक clear है सबको? Simple. Within the diagram also clear. ठीक है? Now, you tell me one simple, very simple thing. Can you see my lower fornix? Can you see my lower fornix? Yes or no? हाँ, I am not showing you from the diagram. You see from my eye. Dr. Shriya, can you see my lower fornix? Yes or no? Yes. So where is the fornix? Where is the fornix? देखो. Fornix is this part, बच्चे, this part, this one. It is like a line, a junction between 1 and 2. Okay? Dr. Shriya, clear? So this is your fornix, the line. Okay? Now, can you see the upper fornix easily? Tell me, yes or no? Can you see the upper fornix easily? No, it's a difficult task. So how do you do that? This is the next question and an expected picture question also. Please see. Please see. This is the instrument which is utilized to see the upper fornix. This is the picture question 5, guys. This instrument is called as decimars. Please write down. Decimars lid retractor. Decimars lid retractor. And what is it used for? It is used to see the upper fornix. And what is the name of the method? Name of the method is the double eversion method. क्या नाम किया है इसका? Double eversion method. Clear? What do you mean by eversion? Eversion means ऐसे उल्टा करना, but एक बार से काम नहीं चलेगा. When you used to scare your friends as a kid, you used to do a eversion. So I'll just show you. This is called a single eversion. But even then you cannot see your upper fornix. For that you have to do it doubly. You have to do it doubly. Again, one more eversion. Is it clear? This is called as double eversion. Now why do I have to see? मुझे देखना ही क्यों है upper fornix? Why do you have to see the upper fornix? Why? It is because foreign bodies can lodge into it. Yes or no? Foreign bodies can come here. ठीक है? It is because the foreign bodies can come here. Okay? So these are 4 questions about your fornix. You can see the lower fornix by pulling the lower lid down. Upper fornix by Desmar's lid retractor. What is the name of the method? Double eversion method. Okay? Now let's talk about the simple topic conjunctivitis. So what do you understand by the word itis here? It is simple, plain inflammation of conjunctiva. Okay, simple, plain inflammation of conjunctiva. Now, the most common type of conjunctivitis is mainly the viral ones, and in the viral, adenovirus is the most common virus to cause a conjunctivitis. Okay? If they ask you bacterial, बैक्टीरिया में से स्टैफ ऑरियस इज द मोस्ट कॉमन वन. If they ask you overall, it is viral. If they ask you bacterial, Staph aureus is the most common organism to cause a inflammation in the conjunctiva. Now, guys, have a look at a patient who has conjunctivitis. Okay, I'll just show you a patient. Now, all of you have a look here. What do you think should be his symptoms? Hanji, what do you think is his symptoms, guys? Tell me. आपको क्या लगता है इसको क्या है? रेडनेस है डॉक्टर इमाद. There is redness, there is irritation, itching, you can say. There is watering as in lacrimation. Very good. And please understand, pain is never a symptom. And what about vision? Vision always remains normal. So please understand two facts about conjunctivitis. Please see, this part is not used for vision, isn't it? Conjunctiva, it's a very superficial peripheral area. This is not included in your refractive surface. It does not have a refractive index. Okay, so it does not cause a loss of vision. Inflammation here will not cause a loss of vision. What about pain? Again, it's a very superficial inflammation, so it will never cause a pain. Pain will be there when you have a central problem like corneal problem, corneal irritation, corneal infections, uveal inflammation. Then there will be a pain. Okay, so please remember, all of you, pain is never a feature, vision is never lost. If you have pain or if you have decrease in vision, think about your diagnosis again. That means maybe your cornea is not normal. Okay, because this is the central part which is required for vision and pain is there. Am I clear, friends? So redness, irritation, watering are the main complaints. Please remember, this is never a pain. Okay. Chalo, let's talk about the first type of conjunctivitis. First type of conjunctivitis. Please write down. The first one is a membranous conjunctivitis. Please write down. The first one is a membranous conjunctivitis. Membranous. Now, what do you understand by the word membrane? So here, guys, if you can see this part, देख रहे हो कुछ गंदा गंदा सा नहीं लगता? Something filthy on the upper palpebral conjunctiva. Here again something yellowish, filthy, ganda ganda sa. Here again this one. Can you all able to appreciate? Are you able to appreciate, guys? So this is your pus. This is your exudate. Now this exudate, this pus can accumulate in the form of a membrane. Where? Over the palpebral conjunctiva. Maybe in the lower, maybe in the upper. ठीक है? Now, अगर कोई ऐसा patient है, guys, this is not a patch actually. This is like a pus which is accumulated in the form of a membrane, a layer, you can say, layer. ठीक है, Dr. Tanisha, it's like a layer. Now, if such a patient comes to you, what will you do? You have cotton bud, the earbud, है ना? You will try to swipe it. Now, if it is cleaned easily, if it is wiped out easily, it's not a true membrane. ठीक है? But a true membrane will be rather, please write down, a true membrane will be rather, will not peeled easily. It will not be peeled easily. And it will start bleeding, guys. It will not be peeled easily. And in fact, it will stop bleeding. It will start bleeding. Not be peeled easily. And also it will start bleeding. So this is the characteristic clinical picture about the true membrane. If it's a false membrane or it's just an exudate which can be because of anything, then it will be peeled very easily. Okay? It will not bleed. Now why do we want to know whether it's a true membrane or a pseudo membrane? So true membrane is basically caused by organisms like Corynebacterium diphtheria, some strains of Streptococcus hemolyticus, and some strains of adenovirus. So Corynebacterium diphtheria is a very dangerous kind of organism. So you must treat these type of conjunctivitis, especially if you have cornybacterium diphtheria, then you might have to give benzyl penicillin injection to the patient, anti-diphtheric serum to the patient. Okay, so please remember. Yes, yes, Dr. Priyam, there is actually a necrosis. Dr. Shubham, true may there will be a bleeding, na? I've written, na, there will be a bleeding. There will be a bleeding. If you have a true membrane, there will be a bleeding. In a pseudo membrane, there will be no bleeding. Okay? Okay, okay, okay. A true membrane, because there is an underlying necrosis, that is why it will bleed and it will not be peeled easily. This is a true membrane. Okay, this is something about the true membrane. So this is your first type of conjunctivitis, membranous one. Okay. Now let's talk about the second type of conjunctivitis. The name is angular conjunctivitis. Angular conjunctivitis. Now this is a very special type of conjunctivitis, guys. Why? Because this, see, Madras eye is any kind of viral conjunctivitis. Okay, Madras eye or pink eye, you can say, it's like a any type of conjunctivitis, mainly the viral conjunctivitis. It's not your membranous conjunctivitis, no. Okay. Now what about angular conjunctivitis? Angular. Please see, all of you, this picture here. And now all of you see here. Can you see something special happening at the skin of the lateral canthus? Can you see this particular region? This is called as maceration of lateral canthus. So angular conjunctivitis is a special type of conjunctivitis where the redness is mainly limited to the temporal part of the conjunctiva, and it is associated with maceration of the lateral canthus. Okay? So please write down this special one. This is associated with maceration of the lateral canthus. This is special. Okay, now why it is happening? Because this is caused by a very specific organism, Moraxella axenfeld. किससे होता है ये? Moraxella axenfeld से. This Moraxella axenfeld secretes some proteolytic enzyme, and this cause necrosis and maceration, excoriation of the skin of the lateral canthus. ठीक है? अब इसकी treatment बड़ी specific है, guys. For the treatment, you would like to give 1% oxytetracycline ointment, or even tetracycline ointment will work. And apart from that, you also give zinc oxide ointment also at the night for the skin part. Okay, please remember, angular conjunctivitis, maceration of lateral canthus, Moraxella, and the treatment with the figure is also important. ठीक है? So बहुत simple question पूछते हैं. In which disorder in ophthalmology zinc oxide is given? So zinc oxide is given for which disorder? Angular conjunctivitis. Oil नहीं है, ointment बच्चे, ointment. ठीक है? Zinc oxide and oxytetracycline ointment, both are the ointment forms. Okay, guys. Chalo, let's talk about the Madras eye, which he was asking. So all of you, please see. Yes, for membranous what? Membranous what यार बोलो? अभी बताया तो था. हाँ, injection benzyl penicillin. Okay. Now, you must have experienced sore throat, rhinitis, and many a times you must have experienced that there is a watering from the eye as well. है ना? देखा होगा ना, जब जुकाम खांसी होता है तो बहुत बार आंख भी बहने लगती है. क्यों होता है? Why is this? Because you have a virus in the body. So you have myalgia also, you have body aches, you have sore throat, running nose, and your eyes also shows watering. So this is a typical Madras eye. ठीक है, पिंक आई and typical serous discharge in viral conjunctivitis. You don't have a mucoid or a purulent kind of discharge, you just shows plain watering. ठीक है, so this is your most common presentation of viral conjunctivitis. ठीक है, please remember. Now sometimes your virus may show something like this. Please see. So we are now reading viral conjunctivitis. We are now reading the third type. This is viral conjunctivitis. And in viral conjunctivitis, the first one is your serous discharge, where you have just plain watering with nedrous eye, the pink eye. The second one is hemorrhagic conjunctivitis, hemorrhagic conjunctivitis, and this is also your picture question, hemorrhagic. Now, what do you understand by the word hemorrhagic? So, guys, you see this picture. It's very, very simple to understand. This is not a kind of redness. This is something different. This is a basically hemorrhage in the superficial conjunctival region, isn't it? It's very superficial hemorrhage. Now, do you think the vision is decreased here? Do you think the vision is decreased? No, the vision is again normal. ठीक है, no matter how dense is your hemorrhage, no matter how big or how large is your hemorrhage, but the vision will again be normal. Now guys, there are 4 viruses which can be very easily learned with the help of a mnemonic pace. Please see, pace. So this is a small mnemonic which I've created, pace, for the viruses which can cause a hemorrhagic type of conjunctivitis. Please write down what is pace. Piconavirus, adenovirus, Coxsackie, Entero70 and echovirus. These are 5 which you have to learn. Simple mnemonic pace. Okay? So we are on hemorrhagic conjunctivitis which can be caused by pace viruses. Now, all these viruses can cause a hemorrhagic conjunctivitis, but it is the enterovirus 70 which is very specific. And a conjunctivitis by this is also called as acute hemorrhagic conjunctivitis. It is so specific that we have given a different name to it. We call it Apollo conjunctivitis or Apollo virus. Okay? You call enterovirus 70 to be Apollo virus. Okay, Apollo conjunctivitis. So मैं क्या कह रही हूँ सुनो देखो फिर से. Viral conjunctivitis, first is the serous, which is most common. Second is hemorrhagic. Hemorrhagic can be because of pace. But when I ask you specifically acute hemorrhagic conjunctivitis, then it should be enterovirus 70. Am I clear? All of you understood? Now, if I give you this picture, guys, if I give you this picture and ask you what can be the other differential diagnosis of this picture, then you have to say DDs of subconjunctival hemorrhage. Then you have to say trauma is the most common one. Next important is hypertension, and rather this is the most common cause in old age. Hypertension. Okay? So if any 65-year-old patient comes to me with such a picture, the first history I would take is about hypertension. Okay? First is trauma, a blunt trauma. Next is hypertension. The next one is when you are coughing vigorously, especially in pertussis. You are coughing and coughing. The next is when you do a lot of weight lifting, isn't it? When you put a lot of weight, not on the body, if you hold a lot of weight. So weight lifting, exercises. Okay, weight lifting, exercises. The next one is when you are on blood thinners. Suppose you are on blood thinners like aspirin, then there can be a bleed, isn't it? Next is when you have vicarious menstruation. Menses, cycles के time पे भी if somebody is bleeding heavily, there can be a bleed here as well. Okay, so please remember these are the causes. Okay, Dr. Modi, is your doubt clear here? So first we were discussing the viruses which can cause hemorrhagic conjunctivitis. Then we discussed the other DDs of this picture. Most common being trauma. If they ask you old age, don't say trauma, it is hypertension. Okay? Two different questions here. Very important picture, guys. I'm sure everybody can make out this is not a conjunctivitis. This is a hemorrhage here. ठीक है, आगे चले now. So we have read two types of viral conjunctivitis. The third one is a acute follicular conjunctivitis. Acute follicular. अब follicle क्या होते हैं? I'll tell you in a short while. Just write down. Acute follicular conjunctivitis can be also caused by COVID. It can also be caused by COVID or coronavirus. Rather, most common ocular manifestation of coronavirus is a acute follicular conjunctivitis. ठीक है? Most common ocular manifestation in COVID is a acute follicular conjunctivitis. ठीक है? और कोरोना भी तो वायरल ही है ना, so this is acute follicular type of conjunctivitis. See, both of them are different things na. A conjunctive, such a picture can be because of trauma, then you don't call it a conjunctivitis. If that picture is because of a virus, then you call it a hemorrhagic conjunctivitis, right? Okay, Dr. Aishwarya. Okay, Hanji. So this is the first thing. Acute follicular conjunctivitis is the most common ocular manifestation of COVID, which generally occurs within first and the second week of corona infection. ठीक है? Which generally occurs in 5 to 10 days of the infection. You see this presentation in mainly 3 to 7% of the affected ones. यानी कि 3 से 7% कोरोना अफेक्टेड लोगों में दिस वाज द ओनली मैनिफेस्टेशन. ठीक है, 3 to 7% of the affected population, okay, of the affected acute follicular conjunctivitis was the presentation. Now what about the treatment here? What is the treatment? Treatment is self-limiting. You don't have to treat it. The treatment is self-limiting. Now, what about the overall viral conjunctivitis? How should you treat a viral conjunctivitis, guys? How should you treat viral conjunctivitis? Very good. It is supportive. It is a supportive treatment. Supportive means you don't have to give much, but if I say what exactly would you like to give, then what should be the treatment? Treatment of viral conjunctivitis or treatment of conjunctivitis as such, first of all you should give tear supplements. ठीक है ना? You should give tear supplements to give a soothing effect to the patient, isn't it? देखो ना, conjunctivitis है, patient आपके पास आया, if you say भाई treatment is supportive, you don't want to give anything, it is self-limiting, so what will happen? The patient will go to another doctor saying that this is a munna bhai, है ना? Isn't it? So it's better you at least treat the symptoms. What was his symptom? He was uncomfortable, he was having redness, he was having itching. So what should you give? You should give something to soothe him. Tear supplements is one. Next thing is you should decrease his itching by giving antihistaminic agents, isn't it? Antihistaminic agent. What else you can give? Yes, the drops. Yes, the drops. Why not the drops? Because the problem is very superficial. It's in the conjunctiva. So you should give drops. Yes, drops. What else you can give, friends? You can give prophylactic antibiotic drops. Prophylactic antibiotic drops. Why? To prevent a secondary bacterial infection. To prevent a secondary bacterial infection. Okay? All right, friends. This much is clear. Now, what about bacterial conjunctivitis? Suppose the patient comes to you with the same complaint, and apart from that, there is a pus, there is a purulent discharge. So, what will you give? In that case, topical antibiotic drops will be the treatment of choice. Very good, very good. No, ceftriaxone injection दोगे. You may give tobramycin, or best is you can give broad spectrum fluoroquinolones. ठीक है, moxifloxacin. ठीक है बेटा. ओके, कंजंक्टिवाइटिस के लिए सेफ्ट्राक्सोन नहीं लगाएंगे बच्चे. इट्स यूजुअली सेल्फ लिमिटिंग और रिस्पॉन्ड्स वेरी वेल टू टॉपिकल एंटीबायोटिक ड्रॉप्स. ओके, चलो. नाउ जस्ट सॉल्व दिस क्वेश्चन गाइस. आज क्या हो रहा है? चलो ये बताओ गाइस क्वेश्चन. Which organism does not cause a hemorrhagic conjunctivitis? Very good. So you remember pace. Everything becomes very easy when you know the pace. ठीक है, सिंपल है ना. चलो ये बताइए. ऑल द मिक्स्ड काइंड ऑफ ए बी सी डी. आई गॉट एवरीथिंग. ए बी सी डी सबने सब बता दिया. तो ये तो अभी बताया ही है मैंने. फॉलिकुलर कंजंक्टिविटिस कैन बी प्रेजेंटिंग फीचर इन ऑलमोस्ट 3 to 5% ऑफ पेशेंट्स. 3 से 5% ऑफ पेशेंट्स में कोई फीवर कॉफ नहीं होता है, उनमें सिर्फ ये होता है कंजंक्टिविटिस. ओके. Now, obviously, you know that it's spread from the tears also. So your phonic secretions may be positive for the coronavirus. Yes or no? Yes. What about conjunctivitis? So this is mostly within first or second week, mainly in 5 to 7 days. This is, early symptom. ठीक है. What about ocular vascular occlusions? You know what is the most common cause of loss of vision in corona? सुना होगा ना आपने कि कोरोना से लॉस ऑफ विजन भी हुआ है. क्यों हुआ है? बिकॉज ऑफ व्हाट? सो इन COVID-19, प्लीज राइट डाउन. In COVID-19, though the most common manifestation is follicular conjunctivitis, but the most common cause of loss of vision is what? Anyone? No, no, Dr. Shubham. Though it is very famous, but the most common cause of loss of vision is vascular occlusion. What vessels? Central retinal artery occlusion, central retinal venous occlusion. ओके, थ्रोम्बस बन गया उसके अंदर. ठीक है. नॉट द म्यूकर माइकोसिस. म्यूकर माइकोसिस इज अ वेरी रेयर कॉम्प्लिकेशन. ओके. Central retinal artery occlusion. It's a painless loss of vision. Yeah. When we talk about retina, we'll discuss this again. Most common cause, please understand this. I'm sure everybody would mark mucor, but mucor is very less. This is also very less, but still much higher than mucor. Okay? Central retinal artery occlusion. Huh, why not? Yes, Dr. Priyam. Yes. Okay? Chalo. So guys, such questions on COVID can also be there. Hang हुआ है ये बिल्कुल. Chalo, try to answer this question. It's a common sense question. Let me see if you can answer. A question with which requires only common sense. Hanji. Try to answer, all of you. Okay, Dr. Priyam को लगता है कि 1 drop is not sufficient. You should put 2, 3, 4. How many drops? This is the correct answer. What is not true? We should always put drops first. If the patient has to give ointment and drop both. ऑइंटमेंट इज टू बी प्रेफर्ड इन नाइट टाइम. प्लीज अंडरस्टैंड अ कॉमन थिंग. ठीक है, सपोज करो ये दो आई ड्रॉप्स है. सपोज ये दो आई ड्रॉप्स है, मुझे पेशेंट को दोनों देना है ना. आई वांट टू गिव टीयर सप्लीमेंट्स, आई वांट टू गिव अ एंटीबायोटिक एज वेल, बोथ. ठीक है, सो मैं क्या बोलूंगी, every time you put a drop, put one drop only. One drop is more than sufficient. The drop quantity is more than the volume of the sac. ठीक है, so one drop is more than sufficient. Now when you put a drop, you, how do you put it, look at me, how do you put a drop? Pull the lower lid down, look up. You need not to do this, ऐसे नहीं करके खींचना, no. Pull the lower lid down, put one drop and ask the patient to close the eyes for minimum 5 minutes. ठीक है. Ideally, when the patient has to put the second drop, there should be ideally a gap of 10 minutes. Ointment should always be preferred in night time because ointment is very sticky. आप आँख खोलोगे तो पूरा blur blur दिखेगा. There will be blurring of vision. Okay? So please remember, ointment should never be the first thing. It should be the last. Okay? Good. Most of you are correct here. Very good. ये क्या हो रहा है इसमें? अच्छा, tell me what should be the treatment here? What is this diagnosis? Suppose एक patient है, what is the treatment here? What is the diagnosis? This is again a hemorrhage. This is a hemorrhage. Must be because of a small trauma. Very good. So this should be self-limiting. How much time? 1 month, 2 months, 2 weeks, 1 week. So ideally, it should go off within 2 to 3 weeks time, not 1 week. ठीक है? Usually 2 to 3 weeks time. It is self-limiting, but it takes 2 to 3 weeks. ठीक है? Minimum 1 week, but 2 to 3 weeks time. It is a self-limiting thing. Very good, guys. Very good. Now, after conjunctivitis, let's talk about the next pathology. It is trachoma. What is trachoma, guys? So this is your end stage trachoma. End stage trachoma. What has happened here? क्या हुआ है यहाँ पे? First understand and then we'll write down everything. So guys, trachoma means rough. It has been derived from a term which means Egyptian ophthalmia, and the meaning of trachoma is rough. You must be knowing that trachoma is one of the most common cause of blindness worldwide. One of the most common. Okay. It is rather the most common cause of infectious blindness worldwide. Now, why the patient has turned blind? It is because the conjunctiva and the cornea are not transparent anymore. Cornea loses its transparency and has become rough. It has become opaque. Can you see here? Cornea का कोई sheen ही नहीं है, cornea का कोई shine ही नहीं है ना? So cornea has become rough. अब ये हुआ कैसे समझेंगे? So कभी आपके साथ ऐसा हुआ था बचपन में? Did you have this? Have you ever बहुत? So what is the logic here? Why I have shown this picture? Why? Because trachoma is caused by 3 F's: flies, fingering, and fomites. So what happens in trachoma, guys? Small children who used to live in a filthy environment, overcrowded areas, and where you can have infiltration of chlamydia trachomatis by the dirty hands, especially when females used to put homemade surma to all the children of the family. आजकल तो एक दो बच्चे होते हैं ना, पहले क्या 10 बच्चे in a single room है ना, and they used to get this kind of treatment, surma, homemade surmas with the finger. So that was the time when we used to have trachoma a lot. So chlamydia trachomatis comes inside the eye of young children. It stays there for many years, many decades, and when you get old, the active inflammation turns into chronic, and chronic inflammation means scarring. So this is your scarred cornea, your rough cornea. समझ आ रहा है? Here, the chlamydia trachomatis has caused Chronic inflammation which has resulted in scarring. Can you see the lashes? What has happened to the eyelashes, guys? Eyelashes are all going towards the cornea, so it's all because of scarring. Your lid has become scarred, your cornea, your conjunctiva, everything has become scarred. Is that clear? So in the old age you become blind, not in the childhood but in the old age you become blind. Okay, so you won't have trachoma now. No, trachoma is almost eliminated from our country now. Okay, trachoma is almost eliminated in our country now. So guys, when you have active inflammation, you may have two types of lesions, papillae and follicles. Please see, then we'll write. जब एक्टिव इन्फ्लामेशन होती है तब बनते हैं पैपिले या फिर फॉलिकल्स या दोनों. तो पैपिले कैसे होते हैं बच्चे? देखिए, पैपिले गिव्स योर कॉन्जंक्टिवा अ वेलवेटी अपीयरेंस. इजंट इट वेलवेटी रेड? इट लुक्स लाइक वेलवेटी रेड, है ना? एंड फॉलिकल्स लुक लाइक साबुदाना, सैगो ग्रेन. कैन यू सी दिस वाइट वाइट लीजन? ऐसे ये क्या है? साबुदाना की तरह लगते हैं. ठीक है, साबुदाना की तरह. सो दिस इज योर follicles. Okay, now let's start writing down something which is important for trachoma. So basically the word trachoma means rough. What exactly is trachoma? It is a chronic. It is a chronic inflammation of conjunctiva and cornea. It is the chronic inflammation of conjunctiva and cornea by what? By chlamydia trachomatis. ठीक है? Now, when I say chlamydia trachomatis, guys, chlamydia trachomatis has different serovars. There are many serovars. So the question here is, trachoma is caused by A to C. Trachoma is caused by A to C. The trachoma which we are reading now is caused by A to C. Yes, A, B, C, very good. D to K causes two problems in the eye. I am only interested in eye, है ना? The first one is ophthalmia neonatorum. Ophthalmia neonatorum. The other one is a paratrachoma. Paratrachoma is also called as swimming pool blindness. It's a sexually transmitted disease, guys. You enter an infected swimming pool and you can get that. Okay? Swimming pool blindness. L causes lymphogranuloma venereum, which is a skin disorder. So I'm not going to tell you this in detail. Okay? Okay? Now, active inflammation, as I told you, active inflammation occurs in young children. But blindness never occurs in young children. Blindness occurs in old age. Why? Because of scarring of the cornea. So this happens. LGV, lymphogranuloma venereum. It's a skin disorder. इसलिए मैं नहीं पढ़ा रही. Lymphogranuloma venereum. स्किन में पढ़ा होगा ना? Lymphogranuloma venereum. LGV. ठीक है? कोई बात नहीं. Just remember LGV. Lymphogranuloma venereum. So active inflammation occurs in young, blindness occurs in old age. How? By 3 F's. What are these 3 F's? Finger, fomite and fly. Okay, these are the 3 F's by which trachoma can occur. So you get trachoma when there is overcrowding, when you are living in poor environmental sanitary conditions. Okay? Now, the clinical features. So I told you, when you have active inflammation, you may have two types of things. You may see papilla or you may see follicles, or there can be both of them. Papillae give your conjunctiva. Papillae gives your conjunctiva a velvety appearance. Follicle give your conjunctiva a sagogran appearance, है ना? यही देखा था ना हमने अभी. Papillae gives your conjunctiva a velvety appearance. Follicle gives your conjunctiva a sagogran appearance. ठीक है? Now, what about the active inflammation? What about the chronic inflammation? So guys, chronic inflammation simply tells you that there is a scarring. There is a scarring. Okay? And scarring is seen in conjunctiva first of all as arch line. Scarring will be seen as arch line. That is a picture question. Arch line. Flies and fomite. Flies and fomite. Flies, fomite, arch line. Okay, arch line. Now what about this arch line? ये arch line होती क्या है? So guys, this arch line is actually, this is actually a scarring in, line of scarring in sulcus subtarsalis. Sulcus subtarsalis. Line of scarring in sulcus subtarsalis. Velvety appearance. Velvety. Dr. Kavita, it's velvety appearance. Arch line is scarring in sulcus subtarsalis. This is a picture question. We'll just show you. Next you can see is a pannus in the cornea. Next, or the most important, is the Herbert's pit. Herbert's pit. Herbert pits are so important that these are actually the pathognomic lesions. You don't have Herbert pits in any other pathology. These are the pathognomic lesions. Okay? Now what exactly are Herbert? Please see. समझेंगे पहले. So you remember follicles, it gives your conjunctiva a sagogran appearance. If you see the follicles which are happening in the bulbar conjunctiva. So Herbert pits are nothing but the follicles which are scarred, depressed and healed. And they are actually at the limbus or at the bulbar conjunctiva. We call them Herbert pit. Okay? So these are some lesions which you see in the stage of scarring. Arch line, pannus and Herbert pit. Herbert pit are the most important ones. These are the follicles which are scarred, depressed and they are present at the limbus. Okay? So you have seen what are papillae and what are follicles. Now let us see what is the arch line. I'll just show you what is the arch line. देखिए इधर सभी लोग. This is important expected picture question. Please see. This is your arch line. Can you appreciate on the upper palpebral conjunctiva we have a line of scarring? All of you please see. It's simple to check here. Easy. So this is your sulcus subtarsalis and here you see a deep groove and this deep groove is your scarred area. This is your arch line. A picture question. ठीक है? और क्या दिख सकता है ट्रैकोमा में? You can see Herbert pits. So what are Herbert pits, guys? Please see. These are your Herbert pit. How do I identify? These are your black lesions. This one. These are your follicles, but these follicles are scarred and depressed at the limbus. देख रहे हो आप? ये follicles तो है, but ये scarred है, depressed है. These are not active follicles. These are pathognomic lesions. So in any patient, if you do this and you see Herbert pit, that means it's a pathognomic lesion. He had trachoma sometime in his life. Okay. Now my next question: what has WHO done for that? भाई WHO ने बहुत काम किया है इस बीमारी में. क्यों? Because this is one of the disorders which WHO is targeting for its Vision 2020 program. So first of all, WHO gave a classification. It is the Fisto classification. WHO gave a Fisto classification. Okay. WHO also gave the treatment. So it says that let's be safe. WHO gave a safe strategy. What is it, guys? What is safe strategy? S stands for surgery, A stands for antibiotic, F stands for face cleanliness, and E stands for environmental sanitation. Okay? So these are the things which are treatment modalities and prophylactic things. Now, my next question to you is, what is the antibiotic of choice? Anyone? Yes, and antibiotic for choice is azithromycin. Azithromycin. This is your drug of choice. Now, my next question: in which cases you would do a surgery? So, when you have a trichiatic eyelash, you have to do a surgery. Trichiasis. What is trichiasis? A misdirected eyelash. You must do a surgery. Okay? Now, my next question. What is this S here? S is stage of scarring. S is stage of scarring. What is T here? T is this trichiasis. T is this trichiasis. Trichiasis. Okay? T is trichiasis. No, they are not embedded in the sclera. It just point towards the cornea. They point towards the cornea. They're not embedded anywhere. It just keeps on irritating the cornea. It causes a lot of foreign body sensation and itching. Okay? Please remember this much. So this was about trachoma. I hope this is clear. कैसे blindness हुआ? It's a chronic inflammation. It stays there for decades. That's why you have loss of transparency of cornea later on. Okay. Now let's talk about the next topic, which is a picture question first of all. So all of you kindly see very carefully. Kindly you see very, very carefully. Hanji. So what is happening here? What is wrong with this baby? What is wrong with the baby? So it's a neonate, a newborn which shows watering, and you know, watering in newborn is pathological, isn't it? Normally, neonates cry the most, but watering in neonates is pathological. There are three causes of watering in a newborn. This is one of them, ophthalmia neonatorum. Okay? Now, this ophthalmia neonatorum is caused by so many organisms and so many conditions. So, first of all, you have to identify the baby. This is a particular case of ophthalmia neonatorum. Now, depending upon the cause, we have classified ophthalmia neonatorum into 5 types. And this classification is at the time of the development of watering. So, if the mother says that the baby has watering just after the birth, we say it's because of a chemical, cum. The simple mnemonic which can help you a lot is come girl out, have coffee. Okay? So come girl out, have coffee. Now, chemical, which chemical? So silver nitrate was used by many doctors earlier in 1% solution. It was Creed's method where many doctors used to put silver nitrate solution on the eye of a newborn, thinking that silver is a very pure material, so it will not let any infection to occur. But it was found that while you put silver nitrates, there was ophthalmia neonatorum. So this method is now obsolete. We are not putting any silver nitrate nowadays. पहले डॉक्टर क्रीड्स ने सोचा कि सिल्वर नाइट्रेट लगाने से इन्फेक्शन नहीं होगा, पर देखा गया कि उसी से होने लगा. So nowadays we are not putting anything on the eye of the newborn. ठीक है? Now, gonococcus When the mother says, by doctor, my baby was absolutely okay after the birth, but within second or third day the baby develops, that means it's because of a gonococcus. Okay, coming from the maternal genital tract. Other means other organisms. Herpes is 5 to 7 days, and typically chlamydia is after 1 week. After 1 week. It is also the most common cause of ophthalmia neonatorum. And guys, do you believe that girls are most dangerous? So most severe is your gonococcus. Please remember these 5 causes. So many important questions from this one. ठीक है? हो गया बच्चे? So there can be questions like that. हाँ जी. Hyperendemic trachoma is caused by which strain? Good. Hyperendemic trachoma is by A, B and C. Very good. All of you are absolutely correct here. ठीक है? Good. ये बताइए. So what is the cause of swimming pool conjunctivitis? What organism causes swimming pool conjunctivitis? So it is also called as paratrachoma, and it is caused by chlamydia. Very good. It is caused by chlamydia. Which chlamydia? D2K. Very good. D2K. है ना? Good. ये बताइए. So scarring in sulcus subtarsalis is seen in what? It is seen in trachoma. Very good. It is seen in trachoma. Good. Okay, what is this line? This line is called as the arts line. Okay, arts line. Very good. Oh, ये बहुत भाग रहा है भैया. चलिए ये बताइए. पैथोग्नोमिक ऑफ ट्रकोमा. Silver nitrate was given for prevention of infection, but it was causing infection. That's why we stopped it. So what is pathognomic for trachoma? If you remember the word Herbert Pitt, but Herbert Pitt is not in the option. Herbert Pitt is not in the option. So what should be this? Bulbar follicle. It has to be a follicle which is on the bulbar conjunctiva. Okay, very good, all of you. Good, good. So this was about trachoma, paratrachoma, and ophthalmia neonatorum. Now let us start with a new topic. Let us start with allergic conjunctivitis. Okay, let us start with allergic conjunctivitis. This is the next topic for conjunctiva. Allergic conjunctivitis. So friends, in allergic conjunctivitis, nowadays we are not giving anything. If there is an infection, if there is a discharge, then we treat accordingly depending upon the cause. We are not giving any prophylactic erythromycin or anything else. Okay? So allergic conjunctivitis, we have to read two. The first one is VKC. What is VKC? Vernal keratoconjunctivitis. Vernal keratoconjunctivitis. So though it's a very old question, but this year also it has come to you. Very simple question was there. Vernal keratoconjunctivitis. Now guys, this vernal keratoconjunctivitis is also having two more names. It is also called as a spring catarrh. It is also called as a warm weather conjunctivitis. So it has two more names. Warm weather conjunctivitis or a spring catarrh. It is famously known as spring catarrh. Now you have to understand this, guys. Is a very important thing. Yeah, not only FMG, but in every exam, guys, you can have questions from conjunctiva, especially this allergic conjunctivitis. Now understand this. What is happening? There is an allergy in the conjunctiva. Okay. Now this allergic reaction, it is a IgE mediated hypersensitivity reaction. So मेरी conjunctiva में एलर्जी हो रही है, कैसे हो रही है? It's a IgE mediated hypersensitivity reaction which is type 1. ठीक है, it is a type 1 IgE mediated hypersensitivity reaction to what? क्यों हो रही है ये? To a exogenous allergen. What do you understand by the word exo? Exo means outside the body. तो मेरी आंख के बाहर, मेरी बॉडी के बाहर कुछ है जिसकी वजह से मुझे हाइपर सेंसिटिविटी रिएक्शन. Are you able to understand? It's IgE mediated hypersensitivity type 1 reaction to any exogenous allergen. Exo means outside the body. And most commonly this allergen has been found to be the pollen grains in the environment. ठीक है, तो ये किन लोगों को होती है guys? This happens usually in young boys, mainly in their first decade. ठीक है, छोटे छोटे लड़के जैसे कि 7 साल के, 8 साल के, what problem they are having? They come to you with frequent itching, intense frequent itching in the eye at the onset of summer. जैसी गर्मी शुरू होगी अप्रैल मई के महीने में, वैसे ही बच्चे को खुजली शुरू हो जाती है. ठीक है, so this is a typical complaint by the mother. डॉक्टर जैसी गर्मी शुरू हुई वैसे ही इसे परेशानी शुरू हो जाती है. ओके, now when I see these patients, I see so many signs. The first is called as the ropey discharge. इन बच्चों की आंख में से ऐसा थिक पानी आता है, we call it the ropey type of discharge. ठीक है, apart from that you see big papillae. Papillae दिखाई देते हैं जिन्हें नाम दिया है cobblestone papillae. Cobblestone papillae, and this was the question this year. Now this is your picture, cobblestone papillae. Can you see guys what has happened? This is your cobblestone appearance. आप देख रहे हो कैसे दिख रहा है? आप रोड पे चलते हो ना, रोड पे, तो रोड के साइड पे जो आपके आपके जो रोड के साइड पे होती है, वहां पे ऐसी कुछ अपीयरेंस नहीं होती है ना. So this is your typical cobblestone appearance, right? The discharge in them is very thick kind of, we call it ropey discharge. Ropey discharge. So this is your cobblestone papillae. Okay, I've not shown any image, no other image. मैंने तो कोई इमेज दिखाई नहीं अभी तक, बस यही दिखाई थी. This is stuck. So you may have cobblestone papillae, and these papillae are very large papillae. ठीक है, large papillae. Please remember you have papillae but follicles are totally absent. And on this you had a question in 2019. Follicles are totally absent. You have papillae only, but these papillae are your cobblestone papillae, very large papillae. No, it's not confusing at all. No, no, sago grain are like bilkul sabudana. They are not elevated lesions. These are white lesions. ठीक है, cobblestone are elevated lesions which give reddish appearance. Your still red appearance will be there. Okay, Dr. Modi, it's not confusing at all. बिल्कुल भी नहीं है बच्चे. Both are very different. Now the third one is Horner Tranta spots. What is a Horner Tranta spot? These are eosinophilic accumulations. क्या होता है इसके अंदर? Eosinophils भर जाते हैं. These are eosinophils which are accumulated at the upper limbus. कुछ ऐसे यहाँ पे eosinophilic accumulations होने लग जाते हैं, raised lesions. ठीक है, Horner Tranta spots. The next one is pseudogerontoxone. Pseudogerontoxon. The next lesion what we see is a shield type of cataract. Sorry, shield type of ulcer. Shield type of ulcer. Okay? So these are the main features. Please remember each and every word is a question. Now, how do you treat? So this is a kind of allergy. How would you treat, guys? There's a small child. How are you going to treat this allergy? So first of all, you can give antihistaminics because there's a lot of itching to the baby. You can give antihistaminic drops. What else you can give? You can also give mast cell stabilizers. Mast cell stabilizers. Yes or no? But otherwise, you have a very wonderful drug which is actually a combination of these two. This is called as olopatadine and this is your drug of choice. ठीक है? क्या है olopatadine के अंदर? It is a combination of 1 plus 2. It is a combination drug and this one is a drug of choice. So it has both the actions, antihistaminic and mast cell stabilizer action. Now, though olopatadine and these drugs are very good drugs, but the problem with these drugs is that they do not control the first initial phase of itching. समझ आ रहा है? So for that first initial few days of intense itching will be controlled when you give topical steroids. And these steroids should be a low dose steroids. Yes or no? They should be low dose steroids, isn't it? If you give a high dose steroids continuously in a patient every summers, what can be the side effects? The baby can develop cataract, the baby can have glaucoma. Yes. So it's better you give low dose steroids and that too for very small period of time. Okay? Now my two questions, please see each of them one by one. If I ask you what is the drug of choice, you say olopatadine is the drug of choice. But when I ask you what is the first drug to be given in VKC to control the intense itching, then you should say topical steroids. Okay? Please remember that will be given the first drug to control the intense itching phase. Okay guys, so there are so many questions on VKC as well. Okay? Chalo, now let's talk about the second type of allergy which is called as phyllectanular conjunctivitis. The next one is phyllectanular conjunctivitis. So the next second allergic type of conjunctivitis is phyllectanular conjunctivitis. We have read first as the first one was VKC. This is the second one. भैया ये बहुत प्रॉब्लम कर रहा है आईपैड ना भैया एक बार देखोगे बार बार स्टक हो रहा है स्टक हो रहा है बार बार ना मतलब पीपीटी बहुत भर गई है शायद इसलिए स्टक हो रहा है बार बार यहाँ से चलाती हूँ तो या तो 10 पेज भर जाएंगे इसको या तो दोबारा से कर लें डाउनलोड क्या करें इसको डिलीट करके दोबारा से कर सकते हैं क्या नेट नहीं है स्टक हो रहा है वहाँ पर एक पेज करते 10 पेज हो रहा है फिर से हो रहा है
मेरी पीपीटी बढ़ गई है शायद, इसलिए मैं इसी में पेज कर रही हूँ। या तो और दूसरी फाइल खोल दो जिसमें मैं नोट्स डालूँ। इसमें पेज नहीं ऐड कर रही। अच्छा दो, मुझे दो, छोड़ो।
So the next type of conjunctivitis is called as phylectanular conjunctivitis. Okay, phylectanular conjunctivitis. Now this is absolutely different. This is absolutely different from your VKC. What is the special thing about this? This is a IG. This is what? This is a type 4 hypersensitivity reaction to a endogenous allergen. To a endogenous allergen. So what is this? What was VKC? VKC was a type 1 hypersensitivity reaction which was because of exogenous allergen, that is most commonly your pollen grains. But this is absolutely different. There is an allergen within the own body. Endogenous means within the own body. Okay. Now what is the problem? Suppose a patient has a hypersensitivity to tuberculin protein or hypersensitivity to staph protein. So sometimes guys, some patients develop a hypersensitivity to the proteins in the own body, staph protein or maybe a tuberculin protein. So this patient may develop a phylectanular conjunctivitis. That's a hypersensitivity reaction. Now usually this also occurs in youngs. ये भी young लोगों में ही होती है, and especially young males. Mostly this occurs in young males again. Now if they ask you about the Indian scenarios में तो TB सबसे ज़्यादा common है. But if they ask you rest of the world or elsewhere, please say it is because of the hypersensitivity to staph. ठीक है? तो rest of the world में it is staph. Indian scenarios it is tuberculin. Okay. Now, when you see these patients, you will have a nodular elevation near the limbus. And this nodular elevation near the limbus is called as the phyllecter. Okay? This particular lesion is called as the phlecter. ठीक है बच्चे? तो जैसे हमने वीकेसी में इतनी सारी चीजें पढ़ी है ना, देयर इज अ रोपी डिस्चार्ज, देयर इज अ पैपिले, देयर इज अ हॉर्नर ट्रांटा स्पॉट, सूडोजेरोंटोक्सॉन. यहाँ पे क्या है? यू विल सी द फर्स्ट लीजन व्हिच इज अ फ्लिक्टर. व्हाट इज अ फ्लिक्टर? इट्स अ नोड्यूलर एलिवेशन नियर द लिम्बस. ठीक है. नाउ व्हाट अबाउट द सेकंड थिंग? देयर यू सॉ अ शील्ड कैटरैक्ट, शील्ड अल्सर, एंड हियर वी सी अ fascicular ulcer. So this is a different ulcer, a fascicular ulcer. Okay, please remember the name itself is a question. Fascicular ulcer is a ulcer which is seen in flectanular conjunctivitis. Now, how are you going to treat? So the treatment is very simple. You have to give topical steroids. You will give topical steroid. These are the drug of choice. Short course of topical steroids will help. But definitely if the patient has a tuberculosis also, what would you like to give? You must give ATT as well. ठीक है? अगर पेशेंट को ट्यूबरक्लोसिस है तो आप साथ में एटीटी भी देंगे. ठीक है? क्लियर? यस डॉक्टर प्रियम, एब्सोल्युटली करेक्ट. Most common in TB is choroiditis or flectin. See, you're confused. See, Dr. Iman, flectin can be seen in TB, but it is an allergic manifestation. Choroiditis or uveitis, I would say, not choroiditis is common. You would say uveitis, mainly the interior uveitis. This is the commonest ocular manifestation of TB. Flectin is an allergic manifestation. Okay? So if they don't mention the word allergic, please say uveitis. Anterior uveitis is more common than choroiditis in TB. Okay? Okay, Dr. Imad and everyone, have you understood these two questions? ठीक है, चलो. So we are done with allergic conjunctivitis. Now we'll start with a new topic. This is pterygium. So first of all, see the picture question here. I'll say it's very, very important to understand. See, this is the nodular elevation near the limbus. Can you appreciate, guys, this one? देख लो ये क्या है nodular elevation. So this nodular elevation is called as the flecton. ठीक है? What is the name here? Flecton. ठीक है? Now have a look here. We'll do the questions later in one go because this seems to be stuck now again. Chalo. So let us finish this topic. This is pterygium. Now all of you understand and then we'll write down certain questions. So what is pterygium? Please see friends, it is a wing-shaped fold of conjunctiva coming and encroaching on the cornea. Can you see? This is all of your pterygium. Now, what happens? Why there is a pterygium? So people who are mostly in sunlight, like your rickshaw pullers, farmers, because of the exposure to UVB rays, there is a elastotic degeneration of the conjunctiva. Okay, there's a elastotic degeneration, and because of this elastotic degeneration, the subconjunctival tissue proliferates and it goes to the cornea. Okay, now mostly it is nasal in location. ठीक है, mostly कहाँ होता है, ये nasal location होती है. And when you describe the pterygium, you describe it in the form of the head. This is the head, this is the neck, and this is the body of the pterygium. देख रहे हो, head, neck, and body. So many a times you will see that iron gets accumulated on the head of the pterygium. Iron accumulates, and this is in the form of a line. We call it the Stocker's line. What do you call it? Stocker's line. Okay. Now guys, when the patient comes to us with pterygium, the most common problem they have is not the decrease of vision, they have is the poor cosmesis appearance, the poor cosmetic appearance. उनको लगता है कि उनकी आंख सुंदर नहीं लग रही. ठीक है. So the first problem they have is poor cosmetic appearance. Then they have the decrease in vision. And when I have to treat it, I'll do a 2-minute job. I'll just pull it and excise it. But this pulling and just excision is a very, very bad surgery because it is associated with almost 60 to 70% chances of recurrence. So what do? You don't want the sclera to be naked or to be bared at this point. जहाँ पे आपने टेरिजियम को हटाया है, वहां पे टेरिजियम की जो स्क्लेरा है वो बेयर हो गई है, नेकेड हो गई है, तो क्या होता है वो दोबारा से रिकरेंस हो जाती है. सो हम क्या करते हैं, वी डोंट लेट, देखो यहाँ टेरिजियम था, सपोज देयर वाज अ टेरिजियम हियर. So what we have done, we have made this part of the sclera bare. We don't let it bare. What do? You place the similar part of conjunctiva from the eye and suture it to this area so that the recurrence is very less. This is called as excision plus autografting. Okay, so this much guys you have to remember in pterygium. Let's quickly write this down. So pterygium is our next topic. It is a wing-shaped fold of conjunctiva which is encroaching on the cornea. Which is encroaching on the cornea. क्यों होता है ये? I told you one is the UVB exposure, UVB light की वजह से UVB exposure, and another thing I told you earlier was a stem cell deficiency, isn't it? Stem cell deficiency. Guys, you remember? Upper part will not become bare because the bulbar conjunctiva is very loose. You can suture it back. Priyam, you can suture it back. It will not be left bare. So this is most common nasal in location. Most common, it is nasal in location. If this is the nose, this will be your pterygium. Okay? Why does it happen? There is a elastotic degeneration. All these words are very important keywords, friends. There is a elastotic degeneration. Okay? When we describe the pterygium, we say this is the head of the pterygium, this is the neck, and this is the body. And sometimes you have iron accumulation over the head of the pterygium. What is this line called as? Stalker's line. This line is called as the Stalker's line. So what is the problem to the patient, guys? The first problem is poor cosmetic appearance. Poor cosmetic appearance, ठीक है ना? The second problem is decreased vision. Now guys, this is something which you must understand. The cause of the decrease in vision early is not pupillary encroachment. It is because of astigmatism. Why astigmatism? When something grows over cornea, look at this, if this is the cornea and something is growing over the cornea, so what will happen? It is going to change the shape and curvature of the cornea. So if the shape and curvature of the cornea changes, what refractive error will you have? You will have astigmatism. I hope this is clear. ठीक है? So the most important cause of decrease in vision is astigmatism. The next is when it comes to the pupillary area, pupillary encroachment. Are you able to understand, friends? If they ask you what is the most common cause of decrease in vision in pterygium, don't say it is pupillary encroachment. It is astigmatism. Okay? So for the treatment, we must do a surgery. The first surgery which I told you was a Bayer sclera surgery. Bayer sclera excision, which is a poor surgery because it is associated with almost 60 to 70% chances of recurrence. It will come again. There's a lot of chance of recurrence. So it is not a good surgery. What else you can do, friends? The best is you do excision plus a autografting. Autografting. ठीक है, you do a autografting. Now one new question which you must learn is perfect surgery. Perfect. So they can ask you, first of all, perfect surgery is for which disorder? It is for pterygium. ठीक है, it is for pterygium. What is perfect? You need not to remember the name. Pterygium extended resection followed by extended conjunctival transplant. You need not to remember the complete name. ठीक है, वो कहते हैं आपको काटना है तो अच्छे से पूरा तक काटो. वो कहते हैं जब आप ट्रांसप्लांट कर रहे हो तो भी बड़ा सा करो ट्रांसप्लांट. ठीक है, सो दिस इज योर परफेक्ट सर्जरी. I hope this much is clear. So you will be able to identify what is pterygium and so many questions related to pterygium. We are planning to take till 4:30. Okay. Okay. For recurrence, yes, you can use so many things for prevention of recurrence. You can use mitomycin C because it's an antifibrotic agent. You can use 5-fluorouracil. You can use drops of mitomycin C per-operatively, pre and post-operatively. You can do beta irradiation. You can use autologous serum. These are all antifibrotic agents. Okay, but इट्स अ टाइप पैथोलॉजी में आपने पढ़ा होगा ना, इलास्टोटिक डिजेनरेशन. यू मस्ट हैव read that in pathology. Two types of degenerations. One of them is इलास्टोटिक. ठीक है. पैपिलरी कहाँ लिखा है बच्चे मैंने? प्यूपिलरी एनक्रोचमेंट, इट कम्स टू द प्यूपिल. प्यूपिलरी इंक्रोचमेंट, डॉक्टर ऋषभ, एनक्रोचमेंट मतलब वो प्यूपिल के ऊपर चढ़ जाता है. प्यूपिलरी एनक्रोचमेंट. ठीक है. Chalo. Now, the last topic from conjunctiva is this. Please see, all of you, what is happening here. ये क्या है? So all of you can see also this is a bite dot saw. Now how to identify? This is absolutely opposite to pterygium. क्या ये temporal होता है? It's on the temporal side, and when you see the base is towards the cornea, the apex is away from the cornea. Can you see the apex is away from the cornea, है ना? It has a white toothpaste like appearance. So guys, first of all, this is a picture question. Now in which disorder, why do you have a white dot spot? Because you have a vitamin A deficiency. Very good. You have a vitamin A deficiency. It's a white toothpaste like frothy appearance. Okay. Now see. Now see. You said vitamin A deficiency, and vitamin A deficiency can lead to xerophthalmia. So my question to all of you is, what is xerophthalmia? My question is, what is xerophthalmia? It's not dry eye. Okay, what is xerosis? What is xerosis? Now you are right, it is dry eye or dryness. ठीक है? हाँ. So friends, what I want to say you is xerosis and xerophthalmia are not same. Xerosis means dry. Xerophthalmia means all of them. So xerophthalmia is all the manifestations of eye because of vitamin A deficiency. Am I clear? All the manifestations in eye because of vitamin A deficiency is your xerophthalmia. ठीक है? It can be night blindness. इट इज नॉट ड्राई आई ना. नाइट ब्लाइंडनेस और ड्राई आई सेम तो नहीं है ना, ये तो अलग है. बट हो विटामिन ए की वजह से राइट. ठीक है. So there are 3 questions here. Please see 2020 you had a question from this topic. Night blindness is the first symptom. This is the first symptom. Dryness of conjunctiva, it is the first sign. Question number 2. Please see white dot spot is not a very sensitive sign. It is a very specific sign. ठीक है? You won't see white dot spot in any other condition. So it is not a sensitive sign, but it's a very specific thing. Okay? Yes, you can use that for screening purposes. ठीक है? White dot spots can be used for screening purposes. Okay, बच्चे? Is that clear to all of you? Now, my question, next question, how do you treat? How do you treat? हाउ मच विटामिन ए, ये तो सबको पता है. विटामिन ए से ट्रीट करोगे, कितना दोगे? कितना दोगे बताओ? 2 लाख किसको दोगे? 1 लाख दोगे? हु इज राइट? अंडर 1 ईयर 1 लाख, 2 लाख चाइल्ड. So very simple to remember. I use this clue to remember. You can have your own clues, but the idea is that you should never get confused. Okay? So if the child is small, 1 year. If the child is big, if the child is small, or if the child is big. So big child, obviously the dose should be big. How much big? 2 lakh international unit. How do you prefer to give anything? आप अपना बच्चा होगा उसको कैसे देना पसंद करोगे? ओरल या इंजेक्शन? अगर आपका खुद का बच्चा है कैसे दोगे दवाई? ओरल ना, तो ओरल ही देना चाहिए. But suppose the baby is severely malnourished, that he cannot eat, he is having kwashiorkor marasmus. Suppose होता है ना विटामिन ए डेफिशिएंसी के साथ associated. If he cannot tolerate the oral dose, then what should you give? Half dose as intramuscular. So you can also give 1 lakh international unit intramuscular. समझ आ रहा है? If the baby cannot tolerate the oral dose, you can give half the dose as intramuscular dose. Now what about the smaller baby? Half the dose here, which means 1 lakh international unit orally. Similarly, half the dose here, which is 50,000 international unit IM injection. So I remember this by the simple way: big baby, big dose. What is big? 2. 2 is the bigger dose. ठीक है? So if somebody asks you how would you treat, so say 2 lakh international unit orally in a child who is more than 1 year of age. Okay, say it like that. So this was conjunctiva, guys. Now let's do few questions. ये सबको clear है बेटा? Is it clear to everyone? Okay, चलो. A very simple one. White rupee secretion is a feature of. So where do you have this white rupee discharge, guys? In VKC, vernal conjunctivitis, है ना? Same as VKC or spring catarrh or a warm weather conjunctivitis. All of them are same. ठीक है? चलिए ये पढ़िए question. So there's a young baby, young boy, like 8-year-old, who came with his mother, presenting with itching in her eye, foreign body sensation since few days, and there has been frequent episodes. Frequent episode means is a recurrence since 3 years. On eversion, you saw that, and a similar question was there this year. अब तो नहीं लग रही ये follicles, बताओ. Somebody was confused between this and the follicles. Guys, do you think they are white sabudana like? No. ठीक है, कोई बच्चा कंफ्यूज हो रहा था ना? आई होप दिस इज नॉट द कंफ्यूजन नाउ, है ना? दीज आर पैपिले व्हिच गिव्स योर conjunctiva a red appearance, but these papillae are now very big. ओके, चलो गुड. जो भी बच्चा कंफ्यूज था, नाउ आई एम श्योर अब कंफ्यूजन दूर हो जाएगी. ये पढ़िए. इट्स वेरी इंटरेस्टिंग क्वेश्चन. ट्राई गाइस, ऑल ऑफ यू ट्राई टू आंसर. हाँ, papillae and papillae. Papillae and papillae have to be same, but papillae here are very big. That is why the name cobblestone. Please read this question well, friends. So Dr. Gautam, Dr. Aishwarya, you are right, but you have to tell me the reason. Why do you think it is A? Dr. Murthy, C क्यों बोला बेटा? C क्यों बोला? So what is the clue number one? The clue number one is nodule around the limbus. Yes or no? There's a nodule around the limbus. But I would say the more important clue is not this. More important clue is that you have an axillary and cervical lymphadenopathy. In our country, if you have an axillary cervical lymphadenopathy, then you have what? Unsaid, you have a TB. So if you have a TB in the body, you have a nodule in the eye. What is the diagnosis? Phylic conjunctivitis. Is it okay? Okay, bache? So what is the classic finding? Okay, nodule around the limbus can be n number of things, but if it is associated with lymphadenopathy in our country, it has to be phylectin. Okay, so please read the question well. पूरा का पूरा पढ़ना है ढंग से हमको. Okay, चलो. Anji, any doubts in conjunctiva, guys? Any doubt in conjunctiva? कुछ पूछना है? चलो इसका आंसर बताओ. आंसर बताओ इसका. रुको रुको रुको. Somebody who has said B. Dr. Aditya, आपने क्वेश्चन पूरा नहीं पढ़ा. Am I right? डॉक्टर आदित्य ने क्वेश्चन पूरा नहीं पढ़ा, है ना डॉक्टर आदित्य? Because he said B, because he forgot to read the word except. The correct answer is C. It is a irreversible ring. Now, why I have kept this question again? Because I want to show you, I want to tell you that even if you do not know about the other options. Don't get confused. है ना? सपोज देर इज अ पैथोलॉजी, सपोज टीबी है, आप सोच रहे हो कि टीबी के बारे में आपको तो सब आता है, बट फिर भी बहुत सारी चीजें ऐसी होंगी जो आपको नहीं आती, जो मुझे भी नहीं आती, है ना? सो डोंट think about that option which you absolutely have no idea. Be confident about the thing which you know. So the fourth option is new to you, and it is a correct option, but it is not necessary that you know everything about the particular pathology or the disease. If you are confidently knowing that it is a reversible ring, you should be able to answer. समझ में आया मैं क्या समझा रही हूँ? हर चीज के बारे में आपको हर चीज आना जरूरी नहीं है ना? आप बोलोगे ये तो मैडम ने पढ़ाया ही नहीं, अर्लियर सीन ऑन गुनियोस्कोपी, तो यही होगा गलत, बट ये गलत नहीं है, ये सही है। मैंने आपको ये जरूर पढ़ाया है कि ये रिवर्सिबल है, सो बी कॉन्फिडेंट ऑन व्हाट यू नो, ठीक है? उसके पीछे नहीं भागना जो आपको नहीं पढ़ाया है। गड्ढे नहीं ढूंढने हैं कि कहाँ पैर मार दें, कहाँ हम गड्ढा ढूंढ के अपना पैर रखें, है ना? गड्ढों को छोड़ के आगे बढ़ना है, हमें भागना है। यस, बहुत सारे बच्चे यार ऐसा करते हैं, you get confused in the exam, you know what is correct, but you get confused about the other options. It's not necessary for everyone to know everything. Okay, तो ये जरूर ध्यान करना है। गड्ढा मतलब, गड्ढे को क्या बोलते हैं यार इंग्लिश में? Yes. It's like, see, I want to tell you, Dr. Murthy, that it's not that you step into a hole. Don't find that pothole. Okay, don't find that thing and step into it. Ignore those things, ignore, ठीक है? Okay, चलो, so that was one question, and here you can remember that KF ring, it should be seen with slit lamp, but the earliest is a gonioscopic diagnosis, ठीक है? It's okay यार, it's okay. I don't know your language, you don't know mine, it's completely okay. चलो, बट द मेन थिंग इज वी शुड बी इंटरेक्टिंग। आपको समझ में नहीं आया तो आप मुझे बताओ, इफ यू डोंट अंडरस्टैंड यू टेल मी, वॉट एवर वे, हिंदी, इंग्लिश, मराठी, तमिल, वॉट एवर, ठीक है? वी शुड बी इंटरेक्टिंग, दैट्स इट। So let us start with cornea. We have few minutes left before the end of the class. Let's start with cornea. Let's read with the physiology and anatomy of cornea. बस यही पढ़ के आज का क्लास खत्म करेंगे, बट आज का क्लास खत्म करने का मतलब है कि कल पढ़ के आना है। Okay, you should come read tomorrow. अच्छे से पढ़ के आना है whatever we have done today. So friends, few things about cornea. The first is, what is the color of the cornea? Let's start with the new topic, cornea. What is the color of the cornea, guys? So cornea is a transparent structure. What about the vascularity of cornea? Cornea is again avascular like that of lens. So what is the source of nourishment to the cornea? If cornea does not have vessels, what is the source of nourishment? So the nourishment part to the cornea is divided into two. First is the oxygen supply to the cornea. The next is the solutes to the cornea. ठीक है? तो ऑक्सीजन कैसे आती है कॉर्निया को? ऑक्सीजन कैसे आती है कॉर्निया को? इट इज फ्रॉम द एयर, द सराउंडिंग एटमॉस्फेरिक एयर. ओके, oxygen is from the air, the surrounding air. What about the solutes? Solutes to the cornea is by the aqueous humor. Now don't say vitreous here. No, cornea is not in contact with the vitreous. ठीक है? It is only by the aqueous humor. It's not by the vitreous humor. Okay? Please remember. Now guys, think about it and you have to tell me. You have to tell me. Suppose this is the cornea of the patient. Suppose this is the cornea, and somebody, there's a girl, there's a pretty girl, and she uses contact lenses for almost whole of the day. This is a contact lens, okay? Do you think contact lens is a good option? What will be blocked here? What will be blocked here if she wears contact lens for a long period of time? The solutes, the glucose will be blocked, or the oxygen will be blocked? Oxygen. Have you understood the concept? Solutes तो आते रहेंगे aqueous humor से, solutes will have a normal supply, but the oxygen will be deprived. Okay, so we don't prefer to wear extended use of contact lens. Okay, very good, good. Chalo, let's talk about the revision thing. What is the refractive power of cornea, friends? What is the refractive power of cornea? Batao. What is the refractive power of cornea? Plus 43 diopters. What is the refractive index of cornea? You know it already. It is 1.37. Okay, you know it already. Now, what is the diameter of your cornea? Your cornea 11 millimeters. Okay. Now, there is a term which is called as microcornea, and there is a term which is called as megalocornea. So, what are these? Hanji, what is megalo and what is micro? So a corneal diameter which is less than 9 millimeters is your micro. A corneal diameter which is more than 13 millimeter is called as megalocornea. Okay, please remember micro and megalocornea. Okay, micro and megalocornea. Now, what about the thickness of the cornea? Thickness of the cornea. So cornea is something like this, guys. It is again thin in the center. It is thin in the center. Now you should remember what is this thickness. So this is called as CCT. क्या कहते हैं इसको? Central corneal thickness. What do you call it? Central corneal thickness. Now this central corneal thickness, guys, you must remember it is approximately 520 microns. It is approximately 520 microns. ठीक है? 530, 520 microns. It is approximately. Okay, it is thicker in the periphery. It is thin in the center, like your posterior pole. Capsule is thin as there. Similarly, cornea is thin in the center. ठीक है बच्चे? Now, tell me what is the instrument which is used to measure this thickness? What is the name of this instrument? How do you measure the thickness? So we measure it by pachymeter. Pachymeter. ठीक है? We measure the thickness of the cornea with the help of pachymeter. Please remember this pachymeter. It is important. Pachymeter. Okay? Pachymeter. So this was the thickness of the cornea. Now what about the sensations of the cornea? Cornea is very richly supplied by nerves. What is the nerve supply? Anyone? What is the main nerve supply? आपका हो चुका है ना ये फिफ्थ नर्व. फिफ्थ का कौन सी ब्रांच? Which branch of the fifth nerve? Which division? Which division of the fifth nerve? Which division of the fifth nerve? The ophthalmic division. Which branch of the ophthalmic division? Which branch? It is the nasociliary branch. Very good. It is the nasociliary branch. Okay, you can say nasociliary nerve. Now look at me, all of you. Nasociliary. So from the ophthalmic division, there goes a branch which is supplying the tip of the nose, the lateral half of the nose, and your cornea both. This is your nasociliary nerve. Okay? So how do you measure the sensations? Sensations of cornea will be measured by an instrument which is called as aesthesiometer. ठीक है? Aesthesiometer. The next is curvature. So how do you measure the curvature of the cornea, guys? Curvature. Curvature is by keratometer. There's no scope of any confusion. ठीक है? Never get confused between kerato and pachy. Pachy is for thickness, kerato is for the curve. ठीक है? Curvature is with keratometer. Good. Now, something about the anatomy of cornea in detail. ठीक है? अब हम detailed anatomy of cornea पढ़ रहे हैं. This is a very important question. NEET PG also gives you question about the anatomy. So corneal anatomy is rather very, very important. ठीक है? Now, before we start writing, I will show you, make you understand, and then we can write everything. First, let us see the layers of the cornea. Aesthesiometer, beta, it is for measuring sensations of the cornea. Aesthesiometer. Aesthesiometer. पीपीटी थक गया हमारा, है ना? Yeah, I know loads of pages. I wanted to close it, but if I close, I'm sure it will go wrong. Something will happen. Tomorrow I'll split the PPTs into many. Tomorrow I'll fix that. Chalo. Finally we are here. So guys, when you see cornea has got 6 layers. Okay, listen to me very carefully. Let's do it tomorrow. No. We'll finish at least the anatomy of cornea. ठीक है, थोड़ा सा पढ़ते हैं डॉक्टर ऐश्वर्या. So cornea has 6 layers. If you start from the outer, the cornea on the outer side has epithelium. Okay, this is the outermost layer. Epithelium is the outermost layer. Now, when you see the epithelium carefully, it is again multi-layered, isn't it? Epithelium itself has many layers. Now, the basal layer of epithelium. Please remember, this is your basal layer of epithelium. This basal layer of epithelium has what? Stem cells. याद है palisade of Vogt? So palisade of Vogt are present in the basal layer of the epithelium at the level of limbus. Okay, you remember this? Now, this epithelium is a very special region. Why? Because of the stem cells, it has the power of regeneration. Suppose there is a trauma and the epithelium is debrided. Some part of the epithelium, there is a defect. What will happen? If you patch the eye for a day or two, this epithelium will regenerate. It's very, it's a very beautiful thing which happens. Same goes with the skin. If you have a defect in the skin epithelium, what will happen? It will come again without any scar. Scar नहीं बनता ना अगर सिर्फ epithelium हट जाए. But if the wound is deep till the dermis, what happens? Again there will be a healing but with a scar formation. Same goes with the cornea. If the wound is deep enough, again there will be a healing but it will result in a scar. Okay, so what is special about the epithelium? The epithelium defects heal without any scar formation. It can be regenerated. Okay, epithelium. Now what about Bowman's membrane? So this Bowman's layer is a acellular layer. It's not a true layer. People say it is just a superficial stroma. It is acellular. It is pass negative. It's not a true layer. Okay. Now what about stroma? So when you see this stroma, this has a maximum area, isn't it? Stroma is having the maximum area. So this stroma has got collagen lamellae. These collagen lamellae are arranged parallel to itself and parallel to successive layers. And then there is a cross linkage bond. This gives the stroma very beautiful arrangement. This is a very regular arrangement of collagen lamellae. Now the next layer is a new layer which is called as Dua layer. Dua's layer is supposed to be the most resistant layer. And Dr. Dua discovered this new layer saying that you can split the cornea into two because this layer is very resistant. So you can split the cornea into two at this particular layer. Okay? After that, you have this Descemet's membrane. Guys, you remember Descemet's? What is accumulated in Descemet's membrane? Your KF ring. So your copper can get accumulated here at the Descemet's membrane. Okay? Now what about endothelium? When you see endothelium, it has just a single layer of cells. Epithelium multiple, endothelium single layer. And what is the shape of the cell? It is hexagonal shaped cells. Look at the next figure. You will see very, very beautiful figure here. So to measure these endothelial cell count, we have a machine, and this machine is called as the specular microscopic machine. Yeah. So kindly see guys, this is your normal endothelium. Normal endothelium. देख रहे हैं आप? So we all have a typical number of endothelial cells. ठीक है, हम सब में एक normal endothelial cell count होना चाहिए. ठीक है, which is approximately 2500 cell per meter square. Let us write down something, फिर लिखते हैं ये. चलो. So corneal anatomy, the first layer is the corneal epithelium. If you see the epithelium of the cornea, it is also multi-layered. Yes or no? It is having many layers. Multi-layered. और क्या पढ़ा है हमने? Basal layer has stem cells. Basal layer has stem cells. What else we have read? This has the power of regeneration. This can be regenerated. Okay, these three things please remember about epithelium: multi-layered, stem cells, and regeneration. Next is Bowman's layer. And I told you that people say it is not a true layer. It is a acellular false layer. Okay, it is just like a superficial stroma. Just like a superficial stroma. What about the next one? Next is the stroma. And you see the stroma has the maximum thickness. It has the maximum thickness. What else? It has maximum thickness and it has a special arrangement of collagen lamellae. Collagen lamellae are arranged in which pattern? They are arranged in a lattice fashion. They are arranged in a lattice fashion. Okay, stroma lattice fashion. Now what about the next one? The next is the Duas layer. Duas layer. Duas layer is a new layer discovered by an Indian ophthalmologist, Dr. Harminder Dua. ठीक है, डॉक्टर दुआ ने क्या कहा? डॉक्टर दुआ बोले कि ये लेयर जो है ये मोस्ट रेजिस्टेंट लेयर है. ठीक है, दिस इज द मोस्ट रेजिस्टेंट लेयर. So you can split this cornea into two. Splitting of the cornea can be done here. Splitting of the cornea can be done here. The next one is Descemet's layer. This can also be regenerated. You can also have the regeneration at this layer. Okay, regeneration can be present. Now the next one is the most important layer of the cornea. This is endothelium. It has got single layer of hexagonal shaped cells. Okay, it has single layer of hexagonal shaped cells. Single layer of hexagonal shaped cells. Now my question, how do you measure the cell count? We measure the endothelial cell count by an instrument called as specular microscope. Okay? Endothelial cell count is measured by specular microscope. So this is the fourth investigation which we have read. Specular microscope. Okay? Now what is the normal ECC? What is the normal ECC? Approximately 2500 cells per square millimeter. तो मैं क्या कह रही हूँ बच्चे, ये जो एंडोथीलियम है, दिस इज द मोस्ट इंपॉर्टेंट लेयर ऑफ कॉर्निया मेटाबॉलिकली. कैन एनीबडी टेल मी व्हाई? दिस इज द मोस्ट इंपॉर्टेंट layer metabolically for the cornea. Why? It is because that the endothelium of the cornea has a pump. The name of this pump is the sodium potassium ATPase pump. So what is the importance of this pump? Let me make you understand. Specular microscope. Specular microscope. Dr. Shubham, specular. Now, listen to this very carefully. Cornea is transparent. Okay? Why cornea is transparent? Because of the layers. The layers behave very especially the endothelium of the cornea. So this has a pump which keeps the cornea relatively dehydrated. Suppose if the pump fails, what will happen? It will imbibe more water. So cornea will have more water, it will lose its transparency and become edematous, become opaque. Okay? So this pump helps in maintenance of the corneal transparency. ठीक है, it keeps cornea, what is the important finding, it keeps cornea relatively dehydrated. Okay friends, it keeps cornea relatively dehydrated. So that is why this is metabolically the most active layer. Now some questions on ECC. Normally we should have a particular cell count which is approximately 2500 cells per millimeter. But when we were newborn, the cell count was approximately 5000 cells. So what happens when we grow old? There is a decline in this age because of the wear and tear. Because of the normal wear and tear, there is a decrease in the cell count. So my count is less than yours. My parents' count is less than me. Now it is said that if the ECC, if the cell count is less than 500 cells, guys, what will happen? अगर सेल काउंट 500 से भी कम हो गया तो क्या हो जाएगा? The cornea will lose its transparency for life. It will become a decompensated cornea. ठीक है? Obviously there will be a blindness. Corneal decompensation हो जाएगी. Okay? By anything. It can be because of trauma, it can be because of surgery, it can be because of old age. ठीक है? If the corneal cells count become less than 500, there will be decompensation. All right, guys, is this topic clear? है ना, क्लियर हो गया ये सब कुछ? अभी मैं क्वेश्चंस पूछूंगी, ठीक है? अच्छा guys, tell me something. Have you heard about eye donation? Have you heard about donation of eye? So what do you donate actually? Can you donate the whole of the eye? मैंने अपनी आँख दे दी तूने लगा ली, ऐसा हो सकता है? Suppose in my family there is a problem or somebody dear to me. Can I donate my eye? You can fix your eye. Very good. So it is only the cornea. When we take the eye, we enucleate. We take the whole of the eye because it's an easy procedure. But it doesn't mean we can implant the whole eye. Only the cornea related blindness can be treated by a grafting. Please understand, whatever you see in movies or serials, this is all that bullshit kind of thing. Okay? You cannot give live person's cornea. मैं अपना cornea नहीं दूंगी. क्यों नहीं दूंगी? मैं blind हो जाऊंगी ना यार. Isn't it? Why would I give my cornea? I will go blind. Okay, so from where do you get the cornea? It is from the dead cadavers. ठीक है बच्चे, है ना? मूवीज में तो दिखाते हैं ना, बॉयफ्रेंड ने गर्लफ्रेंड को दे दी, गर्लफ्रेंड ने बॉयफ्रेंड को दे दी. दिस इज ऑल द रबिश थिंग. इट नेवर हैपेंस. It's the cornea of the dead body you can get. ठीक है बच्चे? Very good. Now listen to this carefully. So friends, people who are blind from cornea related problems, they are very high in number. जिन्हें cornea की वजह से blindness है वो बहुत ज़्यादा है. पर जो लोग cornea donate कर पाते हैं वो बहुत कम है. So Dr. Dua and many other doctors have suggested that why not split the cornea into two? Let us split the cornea into two at the level of Dua's layer. Please see this patient. Please see. देखिए इसको. फिर से स्टक हो गया. यही हो रहा है बार बार ना. जरा सा हिला तो पूरा, नहीं तो हिलेगा ही नहीं. Zoom out and scroll. Zoom out ही है इसका तो. छोड़ मैं चीज समझाती हूँ. भर गया है शायद. बार बार आ रहा है. There's no storage आ रहा है. So before we end, I just want to tell you about the keratoplasty. So guys, the word kera means cornea. The word plasty means a surgery. है ना? So what we do, we are doing a corneal grafting surgery. So here, take it up. So guys, uh,